of the Rooted in Trust research series, where we're aiming at sharing some of the insights from our latest research pieces and discuss a bit what trust means in humanitarian settings. Also, what can we do to strengthen information ecosystems for further preparedness, or how can we address misinformation before and during health emergencies. Today, we will be diving into our latest research piece, which talks about inequity-driven mistrust. We're aiming at understanding how inequity drives mistrust in humanitarian responders and health responders, how that can impact the response, and finally, what can we do to try to prevent or mitigate this mistrust. Next slide, please. For those of you who do not know the Rooted in Trust project, this is an Internews-led global pandemic information response program addressing the unprecedented scale and speed of misinformation and rumors that have emerged, that emerged actually during the COVID-19 pandemic and also after that. We've been working in 15 countries worldwide during the last 3 years, since mid-2020. And our main pillars of work focus on identifying health misinformation through social listening, strengthening information ecosystems. That means creating bridges and capacity among humanitarian actors, media, CSOs, local health actors, and other frontline responders. And finally, also promoting localized information responses. And what does that mean? Trying to promote that it's always local media, CSOs, and local community structures, the ones leading communication and information responses by prioritizing content, creating the information, and also leading the dissemination. The overall goal of this program is to promote resilient and better prepared information ecosystems for communities before emergencies and also during them. Now, next slide. Just a couple of housekeeping, like webinar housekeeping rules. We're planning to have this webinar during the next 1 hour and 15 minutes. Everyone will be muted, so if you have any questions, please share them in the chat box, and we will try our best to respond to them either directly in the chat or during our discussions. We're also recording the sessions, so we will share a link to the video in the next couple of days, together with some slides. So if you miss anything, no worries. You'll be able to get back to it. Next slide. Okay, so before jumping into the research, I'd like to introduce you to the great and wonderful panel that we have today. First of all, we have Alejandro Posada Bermudez, who's the lead social scientist at Rooted in Trust, and he's also one of the co-authors of the research that we'll be discussing. We also have Valentina Riveros and Juliana Jaimes, who are the program coordinators of Sinergias, which is our implementing partner in Colombia. And finally, we have Salam Omer, who's the editor-in-chief of Kirkuk Now, and also one of our implementing partners in Iraq. I am Rocío López. I am the Community Engagement and Accountability Advisor of the Rooted in Trust project, also one of the co-authors of the research, and I will be moderating together with Alejandro today's discussion. Next slide. Now, I would like to give a couple of minutes to Sinergias and Kirkuk Now to introduce themselves and also explain a bit what they've been doing in the framework of Rooted in Trust project, so we all understand where they're coming from and before discussing any further issues. Over to Sinergias, to Juliana and Valentina.
Hola, buenos días. ¿Cómo están? ¿Me escuchan? Listo. Sí, les cuento.
Sí, vale.
Nuestra presentación va a ser en español. Tenemos activados los subtítulos en tiempo real para que nos puedan entender y podamos comunicarnos de una mejor manera. Entonces les cuento, yo soy Valentina Riveros, vengo acompañada de mi compañera Juliana Jaimes. Ambas pertenecemos a una organización que se llama Sinergias, em, que se encuentra trabajando en Colombia alrededor de más o menos hace unos 12 años en temas de salud y desarrollo social con diversas comunidades aquí en Colombia. Nosotros promovemos proyectos en salud y cambio social que respeten las culturas locales en las zonas de más difícil acceso en el país. Buscamos que la salud sea entendida y garantizada desde un enfoque integral, como una sola salud, y de alguna forma que esta salud pueda estar en equilibrio con el bienestar de las personas, las comunidades, el territorio y el ecosistema que los rodea. Em, Hemos diseñado e implementado diferentes proyectos con las comunidades en diversas temáticas, principalmente en la atención primaria en salud, el fortalecimiento de agentes educativos en primera infancia, también algunos temas de procesos de inteligencia colectiva epidemiológica, eh, así como estrategias de prevención del suicidio, temas de salud materna e infantil. También digamos que hemos en los últimos años trabajado un tema muy fuerte de fortalecimiento de capacidades locales, de liderazgo, cuidado y protección del territorio, entre otros diversos temas que podemos trabajar. Digamos que se ha incluido también muy fuertemente en los últimos 3 años el tema de comunicaciones en la organización y pues digamos que fue a partir de todo el tema de la pandemia de COVID-19 que digamos se dio como el vuelco hacia ver la comunicación como una herramienta para fortalecer los procesos propios de las comunidades indígenas. En 2022 hicimos parte del proyecto Arraigados en la Confianza en las zonas de Baupés, Putumayo, Chocó y Caquetá y trabajamos en conjunto con el equipo de Internews para entender pues, los procesos de desinformación durante la pandemia y cómo esta desinformación generó una desconfianza hacia, digamos, la información que se producía por las instituciones, las organizaciones y las entidades, digamos, que generaban información que a las comunidades indígenas no les funcionaba o que de alguna forma, por venir desde las ciudades principales, no se entendía mucho. Digamos que durante 10 meses realizamos espacios de conversación sobre salud intercultural, así como unos talleres de capacitación a comunidades indígenas sobre temas de comunicación, producción de información, como una estrategia también para combatir esa desinformación que se estaba generando. Em, Se trabajaban temas de fotografía, video, realización de textos, también algo de dibujo. Entonces, la idea era como entrenar a algunos agentes o algunas jóvenes como, indígenas para la producción local de información en temas que ellos tenían interés. También se generaron unas conversaciones alrededor de la comunicación intercultural como un espacio de fortalecimiento de capacidades para otros procesos que ya se estaban gestando en la comunidad y a nivel local. Em, y pues adicionalmente se hizo todo un proceso de acompañamiento con Internews para realizar una investigación de cuál era la desinformación que se estaba generando en medio de la pandemia en ese momento por diversas temáticas, como por ejemplo la vacunación. Entonces teníamos que las comunidades indígenas tenían, les llegaba información diferente o inicialmente les llegaba información sobre la vacunación que les generaba, digamos, por ejemplo, otras afectaciones a la salud que las que podía generar normalmente la vacuna y eso provocó que hubiera como una desconfianza mayor a todas estas formas de poder hacerle un frente a la pandemia en ese momento. Entonces, ese fue un poco como el trabajo que se hizo en ese momento con el proyecto Arraigados en la Confianza, junto con Internet.
Thanks so much, Valentina. Now I will pass it over to Salam, and I would like to, sorry, Salam, but we're a bit now a bit delayed. So if you can be brief on what you've been doing in the frame of the Rooted in Trust project, and also, present a bit yourself. Thanks so much.
Hello, everyone. Very pleased to be with you in this webinar. I'm Salam Omar. I'm representing Kirkuk Now News Organization, which is a digital news organization representing in northern Iraq. The main focus of Kirkuk Now as a news organization is to report and produce verified information and quality journalism for the minorities in northern Iraq, and including like IDPs, refugees, and other underprivileged groups in northern Iraq. So we are one of the very few independent news outlets across Iraq, and as part of the Rooted in Trust project. So we were working on three topics in fact. So one of them was production and dissemination of content. So we actually been one of the implementing partners who was responsible to produce quality verified information within the project. And another topic was our media support trainings. So we were responsible for organizing and also sending out the calls, and also organizing the training during the project. Another issue which was very important was the coordination between the journalists and also relevant authorities in those areas we covered. So overall, we have been part of this, and I think overall, as the outcomes which we have seen during the project, which was very helpful at two levels. At the level of organizational growth for us, getting more experience on how to do that, and also building networks with local authorities.
Thank you.
Thanks, Salam. So now next slide. Thanks both for sharing this introduction. Now I'm gonna go to the core of the session, which is talking about trust. So one of the things we've been actually discussing a lot at Rooted in Trust project with partners, with the humanitarian community at large, it's actually what is trust, especially for health responses, and what's also the relation between humanitarian and health actors and the people they're intending to serve. And we have seen how this can actually have an impact on the crisis response, either by enhancing it and promoting collaboration and cooperation, or actually creating an environment of mistrust and suspicion that can fuel further misinformation and risk for communities. So we've been working on a framework that allows us to understand and measure whether communities trust us and the information provided. And we're gonna play a video so you understand a bit better.
When you are overwhelmed with information, it can be challenging to decide what information to trust, what information is safe, and who you should believe to make decisions for yourself or your family. Here are 4 important elements that help communicators understand the building blocks of trust, why facts are sometimes distrusted, and why rumors are sometimes believed. These 4 elements are accuracy, proximity, intention, and agency. Let's take a closer look at each one. The first element is accuracy. Facts matter, and it's important that the information you give is correct. But even correct information can be out of date or come at the wrong time. And if information doesn't seem relevant or adapted to the context, it may come across as tone deaf and undermine the credibility of the factual information. The second element is proximity. Trust grows when people feel heard, understood, and supported. Are you sharing information in the right language? Does the community know how to reach you? Information from someone who is like you and understands your experience reduces the obstacles between you both. This could relate to shared religion or ethnicity, sexual orientation and gender identity, age, physical abilities, or more abstract things like recognizing shared experiences. All of this creates a feeling of closeness or proximity. The third element is intention. If someone isn't sure why you're sharing information or where it comes from, they might still decide not to use it, even if it is correct and relevant. It's important to explain your intentions, to manage expectations about what you can and can't do, what you know and what you don't. People need to feel you're reliable and you can deliver what you promise. And finally, agency. Agency is the idea that to treat people with respect, you need to allow them to make up their own mind. Information should be shared to support people making their own decisions, not to tell them what to do. This also means that you make sure the information they share with you is held safely, that you respect boundaries, privacy, and that you accept criticism and own up to your mistakes. Trust is built on mutual respect for each other's values, opinions, and contributions. These four elements, accuracy, proximity, intention, and agency, go towards building a healthy level of trust in the information you provide. Not blind trust, where everything you share is accepted without question, or absolute disregard, where anything you say is ignored. A healthy level of trust allows space for questions and gives people the confidence to make decisions for themselves.
Thanks. So this is just a summary of the tool, and we obviously invite you to get in touch with us if there's any questions you have on this. But we would like now to jump on the research paper and also discuss another element that actually affects that trust beyond proximity, accuracy, intention, and agency, which is inequity. And now over to you, Alejandro.
Thank you, Rocio. So today we will be presenting the inequity-driven mistrust research, which is one of our latest research outcomes. The paper basically argues that inequity is a significant yet often overlooked driver of mistrust in information, and that the failure to acknowledge and address it can actually seriously hinder the effectiveness of our response. So we will present how we reached this provocative finding, and you will notice that the language of the trust framework is embedded throughout the analysis. So to start a little bit of how we reached to our research questions, well, basically at Internews and Rooted in Trust, we're interested on the effectiveness of health and humanitarian response for at-risk communities. And what we know is that trust in information is an important determinant of that effectiveness for health and humanitarian response. So we've looked into ourselves to see what are some of the drivers of trust that are most prominent within our communities. And through our rumor and fieldwork data, we've realized that inequity is actually quite an important component. However, we identified a research gap here because most research that looks at this relationship is based on high income settings and mostly coming out of the US. So we saw that we had a privileged and unique opportunity to look into this research question. And this is how the paper is constructed. Our first question looks at how does inequity actually drive mistrust? How does this operate? The second chapter looks at how does this impact humanitarian and health response? So now that we understand how it operates, what are the actual impacts? And we finished with a third chapter that looks at what can actually be done to mitigate and address the impacts of inequity-driven mistrust. So it has a practical and actionable section at the end. How did we carry out this research? It consisted of 4 methodological steps. So we started with inequity word maps. This was a really fun exercise in which we got together with country teams, with the project managers and the data analysts and the community engagement advisors. And we basically asked them to come up with a list of words. This could be institutions, regions, public figures, expressions that were commonly used in their context to refer to instances of inequity, injustice, unfairness, or any sort of unbalanced power dynamic. And we took that list of words and we jumped into our second methodological step, which is that we run it through all of our rumor data and we extracted all the rumors from those countries that mentioned those words. This basically gave us a list of rumors that could potentially have embedded emotions of inequity or unfairness or injustice. We analyzed those and we identified themes and scopes, and that's how we built our qualitative instrument, which was a focus group discussions and key informant interviews that we completed in Iraq and Colombia. And these were carried out with different actors, including community actors, youth leaders, with the media, and also with health actors. We analyzed all of this through a participatory, qualitative, thematic coding. It was a messy but really fun process that we did through a software called Deduce, and that's how we came to the core of our findings. So it's an interesting methodological step. And this is basically what we came up with and what we're going to be discussing at length today. And it's the summary of our paper. And it's the first chapter, which basically is how does inequity drive mistrust? So we identify 3 areas through which inequity drives mistrust. Then we have our second chapter, which basically looks at how does this, now that we've identified this, how does this actually impact health response? And we have 3 major impacts that we're going to be discussing in detail. And of course, we finished with this practical chapter that it's telling us how can we address those drivers? How can we mitigate those drivers? Address those drivers in order to mitigate the impacts. So that's sort of like the logic of how this is constructed. So let me guide you through some of our thinking and how we came to these conclusions. So we start with this first sort of more chunky chapter, in which we look at the drivers. How does inequity actually drive mistrust? And what we see here is that it is multi-layered. And what we mean by this is that it happens at different instances. So we start with the first category, which is this structural grievances, those more historical events that happen beyond the emergency. Before the emergency, they already exist, and they end up affecting information, trust in information during the emergency. Then we have this inequities that exist as part of the health response. So they're part of the health response, but not necessarily the information response. However, they end up influencing trust in information. And finally, the more obvious ones, which is actually the information practices during the emergency. So how information is made available and the type of information that's made available. What's interesting here is that this counters that notion that mistrust and inequity is just limited to access to information. It tells us that in reality, it's much more complex. It's historical, and it's a result of ongoing, but also historical processes that need to be acknowledged and addressed. So that's a bit of what we're looking into here. So now let me look at the different drivers so we can understand them better. So we start with this first, which is the more structural drivers. So this is really about those historical and ongoing inequities that exist beyond the emergency. And what we found here is that there's instances of historically fractured relationships between communities and actors at all levels, at national, at local, and at global level. Of course, this is not generalized, but we're talking about instances in which this happens. So what we saw here is that this historical fractured relationships, they are usually the result of some sort of injustice or empowered dynamic, which has resulted for communities in poverty, lack of stability, loss of freedom, or inequity. And this is what's driving that mistrust. What's interesting here is that for low-income settings, this happens at different levels. So for example, we heard instances of indigenous communities in Colombia feeling that they face an inequity within the Colombian system, with the Colombian government, for example. But at the same time, they also feel that Colombia as a country faces an inequity in a global system. So we see this coming across in our rumors. Here's a really powerful example from northern Iraq, where a community leader told us, we cannot trust the central government because many people in these camps here are survivors from ISIS. So for example, they were told to return to their houses, and the government took them and locked them in prison for 15 years. So even if they provide health information to us, we cannot trust it. If the government has not even provided legal help for us, how can we trust other information they bring? There's another angle to this structural inequality, which is about access to quality and health services. And what we saw basically is that vulnerable communities in low-income settings, they can have a history of susceptibility when accessing quality healthcare. And although it might seem obvious, it's not always sort of included in our information response, but this history of limited and low quality services has created deep-rooted mistrust. So when you go to these communities and you tell them, go to the hospital, get vaccinated, it's happening within this context. And there's a reluctance to this trust that is historical and that raises doubts about the capability and the intentions of those information providers. So that's the first driver. We jump into the second driver, which is more about those inequities that exist during the design and implementation of a response. So they're actually a part of the response. And here we identified mostly like top-down responses. So when there's top-down practices, those sort of help to drive that feeling of inequity and mistrust. The first one were basically tokenistic or non-participation. And what we saw here is that when there's a lack of participation, this contributes to a decontextualized response, and it makes our communities question the intentions of actors. In Colombia, we heard a lot of instances in which traditional healers and communities complained that these traditional healers, they were poorly consulted or included as part of the response. And even when there is sort of token participation, but it's mostly tokenistic, so it's like decorative and it's not really for decision making, this can also sort of drive that mistrust. The second is an unwillingness to listen to communities. So when there's that lack of two-way dialogue, the response also becomes decontextualized, and that also drives mistrust. And the last one is the lack of presence in the community. So this is a lot when actors come in just for the response, but they haven't built that trust from before. This can actually sort of create a lot of questions, and it can end up becoming rumors within the community. So that the importance of being there for a long time. And finally, we have this more sort of like questionable and corrupt practices. And what we want to highlight here is that overpromising. So we captured a lot of instances in which, not always because of malintentions, but overpromising is sometimes used by actors to get initial buy-in and initial sort of like excitement about a project. But when we fail to deliver on those promises, it fractures the trust relationship in the long term. And it affects the perception of the capability and interest that these actors might be bringing. What's interesting here is that this can actually end up affecting an entire sector. So we heard, for example, from Iraq, from humanitarian actors telling us they would go to a community and the trust was already broken before they even came in because of that sort of history of overpromising by other entities. So all things to keep in mind. And we reach the third driver, which is about the actual information practices. So we start with this lack of access to relevant information. And what we find here is that it is not just about the availability of factual information, but it's about the relevance of that information. So accuracy matters, but just as important is representativeness, understandability. So what we saw is that there's mistrust when communities lack information that is factual, that is localized, that it's not prescriptive, so that they want to have agency in their decision making, that is in their preferred language, that's actionable, and that it is transparent. So there's this really powerful quote from a listening group in Colombia, where this community, this indigenous leader told us, people do not trust, nor did they trust during the pandemic in hospitals. Indigenous people have historically been rejected in the health systems. There's no referral for us. There's no translation either. So it has that sort of language component. People don't trust what they're saying, and it has that localization component. And to finish off with the drivers, just as the information that's provided is important, the way in which that information is produced and disseminated can also contribute to that inequity-driven mistrust. So for example, when there's a lack of transparency in data collection practices, like when there's extractive research or social listening, where the way the data is being captured and used is not clearly communicated. Also, when there's a lack of involvement in the production of information, this basically affects representativeness. And I'm sure our partners from Iraq are going to be able to tell us a lot about this because they've been working a lot on that. And finally, when there's a lack of coordination between services and information provision. And what we saw here is the two seemingly opposing scenario, but that end up affecting similarly. So for example, We saw instances in which vaccines would be brought, but there was no information provided alongside, no awareness campaigns, and so that created a lot of mistrust. But also the opposite scenario, in which information was brought in telling people to get vaccinated, but there was no vaccines actually available for the population. And so that actually also created a lot of mistrust. So it's about that lack of coordination between service and information provision. So with this, we finish. Again, the paper has much more details and a lot of powerful quotes, but the main three drivers. And what's important here is that it's multi-layered. It happens at different stages, and it's not just about the information we provide. That the inequity-driven mistrust in information is a result of a broader process. So having established sort of that part, we jump into this next chapter, which basically looks at the impacts. So now that we know how it operates, how does inequity actually impact health response? And we focus here on health response, but this is also relevant for humanitarian or emergency response at large. And what we see here is three main impacts. The first one is the way that communities engage with information. The second is their health outcomes. And the third one is the way they relate to a humanitarian response. And what this chapter is really trying to show is that inequity-driven mistrust, it's relevant, is significant, and that it can see that and that it must be sort of acknowledged and understood within our programming, as it can seriously hinder the effectiveness of the work that a lot of us are doing. So let's go a little bit into the different impacts. So this first one, it seems quite obvious, but basically what we found is inequity-driven mistrust affects the way that communities engage with information. And here we find, again, two seemingly opposing phenomena, but both of which represent a great risk. So the first one is basically that inequity-driven mistrust can contribute to an active engagement with mis- and disinformation. What we see is that sometimes the frustration associated to inequity-driven mistrust, it comes in the form of legitimate questions and doubts by communities, but which can end up turning into rumors. So again, this quote from Iraq, very powerful. It says, it was a humanitarian actor telling us, inequity affects us because community do not trust us from the very beginning. We go to help, they have trust issues. They ask themselves, are these people real? Are they here to serve us? Is it real, or do they just want to give us the vaccination? Which can sometimes be turned into, they will make us infertile, because they reach a point where they do not trust anyone, because everyone has tried to abuse them in different ways. So again, it can result in an active engagement with misinformation, but also we saw that it can be used by disinformation campaigners, so by those spreading purposeful fake news. Those narratives and those emotions can be embedded into those fake news in order to give them more traction. There's an interesting map that you can check out later through the link. It's also on the paper, but it basically shows the analysis of the various rumors we found. And on the other side, so this is the seemingly opposing impact. Whilst for some it can result in an active engagement with rumors and with disinformation, for others, it can actually result in a purposeful disengagement from official sources. So what we saw here is that when basic needs are not met, and when the information available does not speak to the real concerns of communities, this can result in a decision to not even provide attention to that official information and to look for information elsewhere. And both of this, the active engagement and the disengagement, are both they both have impacts on the information ecosystem and the response. With the people that disengage, it can sometimes even be harder because it's hard to get their attention or to start a conversation. The second impact is about health outcomes. And the first one is related to that sort of decision to disengage, but it's basically that disengagement can result in communities missing out or choosing to ignore some of the recommendations, the health recommendations posed by those sort of official actors. And in extreme cases, that information can even backfire, with some communities looking for completely different solutions. So whatever they're telling me, I'm going to look for the opposite. which sometimes can result in harmful practices, such as, for example, the use of chloroquine during the pandemic that we registered. And while it impacts that willingness to follow health recommendations, we saw that it also affects the long-term relationship between communities and healthcare providers. There can be long-term irreversible damage here when trust is broken. What we saw is a vicious cycle in which inequity-driven mistrust basically distances communities from health systems. And this distance makes it harder for communities to position and voice their needs and concerns, which further increases that inequity-driven mistrust. So it's like a vicious cycle which has impacts on the health outcomes of communities. And then the final impact that we have here is it's basically a frustration with humanitarian actors. So what we've captured were basically broken relationships between communities and humanitarians or civil society organizations, or the response as a whole. And this was basically associated to that humanitarian and development organization nexus. So basically, as we've learned, trust is a process that takes a long time to build. And particularly in some areas in Iraq, but also in Colombia, we saw a lot of sort of confusion and feelings of injustice of how transitions are made of when actors come in and when they leave. So when certain humanitarian actors start to leave, and it might be poorly coordinated or communicated, and then this might lead to sort of like a broken sort of trust relation that is going to end up affecting future health crises. So again, here the idea was to show that there is real impacts to the work that we do, and it is relevant to look at this inequity-driven mistrust. I'm going to now pass it over to our guest speakers. They're going to have each around 3 minutes to tell us how has the impact of inequity-driven mistrust affected the work that they do in their communities. So maybe we'll start with Sinergias.
Hola, listo. Bueno, pues principalmente las inequidades de las que podemos hablar son históricas y hay muchas en diferentes ámbitos, pero para ir de pronto más cercanos con el tema de la investigación y con lo que estaba hablando Alejandro, podemos identificar algunas de estas. La primera es el acceso a una red de conexión o a una comunicación constante. El Baupés, específicamente me voy a referir de esta región que queda en la Amazonía colombiana, al sur de Colombia, no tiene un acceso constante a Internet, y esto impide que tengan acceso a información de calidad, que tengan capacidad de contrastar la información a través de diferentes fuentes o que puedan generar sus propios procesos de comunicación local. Esto es una de las cosas que intentamos impulsar a través del proceso con Internews, especialmente la importancia no solamente de tener un acceso a la comunicación constante y de calidad, sino a la producción de información para fortalecer procesos de desinformación y sobre todo fortalecer la representación de las visiones propias que normalmente no se han contado, pues, digamos, en medios de comunicación o en otras fuentes de información en Colombia. También otra de las inequidades que se relacionaba directamente con la investigación tiene que ver mucho con los servicios de salud. El Baupés es una región en la que las diferentes comunidades indígenas viven a lo largo de diferentes cuencas de ríos, y esto hace que para poder acceder a alguna comunidad pues pueda hacer un viaje de horas e incluso pues horas a través de río y luego horas caminando. Entonces, las condiciones geográficas del territorio hacen que el acceso oportuno a la salud no esté garantizado. Y esto se suma incluso a que cuando hay acceso, este acceso no tiene un enfoque diferencial para las comunidades indígenas y no hay, digamos, como un respeto o una articulación con sus propias visiones de lo que representa la salud, lo que representa sanarse y demás. Esto en cuestiones de COVID fue uno de los puntos más importantes a los que nos enfrentamos por el hecho de que la pandemia era vista de otra forma, era para ellos un tema también espiritual, digamos, tenía muchas cosas más profundas que el virus y las formas de sanarse también lo eran. Entonces la medicina tradicional fue bastante utilizada por las comunidades indígenas para poder sanarse y para poder defenderse del virus y por supuesto esto fue empleado a nivel comunitario, pero digamos nunca hubo una articulación en temas de protección y bioseguridad desde el gobierno nacional con estas visiones propias de salud. Finalmente, la diferencia del idioma pues fue uno de los temas que también fue una barrera, porque estas comunidades hablan en lengua propia y todas las comunicaciones de bioseguridad y bueno, todas las incluso organizaciones internacionales de cooperación internacional que llegaban al territorio tampoco pues podían comunicarse en su idioma, en su lengua propia y esto hacía una barrera de comprensión y nuevamente de reconocimiento de los saberes propios y de las propias formas de entender. Entonces, como digo, estos son brechas históricas pues como en las comunidades indígenas, no solo en el Baupés, sino en general en la mayoría de lugares donde habitan comunidades indígenas en Colombia. Y con el COVID, estas brechas se hicieron aún más evidentes. Y pues es un poco como la reflexión o como el trabajo que hacíamos junto con Internews y las comunidades, como no solamente de reconocimiento, sino también de articulación con las formas de contar, con las formas de informar y con las formas de entender estos procesos pues sociales a los que nos enfrentamos.
Perfect. Thank you very much, Valentina. And now I'm going to pass it over to Kirkuk now.
Kekugao as a news organization was born as a response to the imbalance we have in the Iraqi information system. So especially because we focus on minorities, IDPs, refugees, and the underprivileged groups. So that was, many of the outcomes I have seen so far is very in parallel with what we have seen and suffered over the past 10, 15 years when we work in the area of content production and in information production in those areas, especially when minorities and the underprivileged groups are not represented in the newsroom and they are not representative in local authorities and for instance their languages are not respected. And this we suddenly, when we came into the pandemic, we have seen how these inequities and how these imbalances in the production of information affected the trust between local authorities, between and the people, and especially members of those communities, and between thousands and thousands of local IDPs, refugees, and the humanitarian organizations and the news organizations as well. So I do believe that this is one of our biggest challenges over the past 10 years, how we actually overcome this challenge and then how to do that. So we have been taking many ways to decrease and reduce this imbalance which we have in overall media organizations and the way we produce information and verified news for the locals and overall in the community. And then during the pandemic, and especially during the even in the vaccination period, because they were not represented in the production of news and information, we suddenly forgot them. Actually, the link between local authorities and the IDPs and the marginalized groups, and the way even when there were campaigns, awareness raising campaigns about vaccination, about the pandemic, we knew later that for the two official languages have been mainly used, and then many members of the local members of those communities actually left out, and this has created actually a very big gap between members of those communities and the news organizations, between members of those communities and the local authorities, and also the humanitarian actors. So I do believe that that was one of the biggest challenges we have been through over the past 10 years, especially during the start of the pandemic and also during the vaccination. Later on, we can talk also a little about how we did that to overcome that, and actually to overcome some of those challenges.
Thank you very much, Salam. Yeah, we're excited to hear about those strategies that you used. So I'm going to pass it over to my colleague Rocio now for the last section of the paper, which are basically the recommendations.
Thanks, Alejandro. So yeah, I'm gonna share a couple of recommendations that follow a bit the logic on the avenues for mistrust that Alejandro was mentioning at the beginning of the findings presentation. These were identified with key informants like Salam, for example, but also they build on some of the lessons learned that we have identified throughout the last 3 years of the Rooted in Trust project. So the first set of recommendations talks about the structural inequities and what can we do to try to address them and ultimately try to avoid or prevent the impacts that also Alejandro was mentioning. In terms of the historical marginalization, it's quite important that we consider the past and lived experiences of the communities that we're engaging with them, as that can have a real impact on the community's relationship with humanitarian and health actors today. Some concrete actions could be like conducting focus group discussions with community members to understand how they perceive the response at large or the specific actor, our own organization, and try to build from there. Obviously not stepping back from criticism, and also trying to promote and allow like a healthy feedback cycle that allows also discussion on what was done before and also those historical grievances. It's also important to ensure a dialogue between Western and indigenous or traditional knowledge systems. As the Western knowledge paradigm with its ways of understanding and recording reality has often questioned or actually overlooked indigenous knowledge systems. But for many communities, these cultural forms, these spiritual practices, or even systems of classification inform day-to-day decision-making, even in emergencies. And we have seen that actually in Baupés, how it was essential amidst the COVID-19 pandemic to engage with sabedores or with traditional healers who were actually guiding the communities on what they should do and how they should protect themselves. So some concrete actions could include traditional healers and spiritual leaders at the local level in the network of frontline responders, and make sure they're also part of that information exchange, and they can also contribute to programming adaptation, complementing our view of the response more from a Western like healthcare or medicine perspective with a more traditional one. And this would also be relevant to when we discuss risk communication or community engagement practices, as they can actually contribute to shape the information and the communication along specific concepts of healing, health, death, or even types of burial that are quite important and can be actually conceptualized from different perspectives. Then we have, in terms of the gaps in access to quality health services and the inequity that comes with that, it's essential to consider how gaps in the access to these services contribute to exacerbate further the mistrust in health actors right now and under guidance, because it's very difficult for certain communities to trust health actors that have continuously failed at delivering services throughout decades, maybe, and now tell them to trust us on the guidance that we're providing. So some concrete guidance could be to conduct focus group discussions and understand the experiences of people with health services, understand what are the relations with local hospitals, for example, or local health centers, and very important, discuss options and limitations, because a lot of times there may be like challenges in the capacity of maybe the health system or the health center, and this is something that needs to be discussed. Why is it so, and what is being done to address that, as a way also to manage expectations and continue building that trust in this open dialogue. Next slide. Then the second set of recommendations talks about inequities during the health response and how we can try to mitigate those. In terms of the challenges in the tokenistic and non-participative approaches, it's important to acknowledge the existing capacities of the community. So communities across the world have vast capacities and structures to respond to the adversities, and while there may be the need to support with technical expertise. It's always important to consider what's already there, what's the local expertise, and incorporate that. So some concrete actions could be conducting a mapping of local response actors' capacities, ensuring the community structures are included and also are at the forefront of the response, and incorporate them into emergency planning. And also training community members when capacity gaps are identified, mainly during non-emergency time, so they're also better prepared to respond and implement directly, trying to also breach that potential mistrust relation between humanitarian actors and local ones. In terms of, there's a second one which talks about ensuring continuous participation of communities in preparedness and response plans, as they can also inform technical actors about priorities, needs, and strengths. So it's essential to have the civil society organizations part of preparedness and emergency plans. Also ensure that there's a participation of vulnerable groups.
Hello, Rocio?
Yeah? Can you hear me?
Is anyone else having trouble listening to Rocio?
No, I think no? I can hear it.
It's okay.
Okay, so sorry. Technical issues always. So yeah, it's essential to have communities be part of preparedness and response plans. And as I was mentioning, like incorporating vulnerable groups, understanding what are the risks, and also the barriers that they continuously face to access information, and to take decisions on it, because it may not be the same for the larger community than specific groups within it. And finally, also having social listening guiding preparedness plans. So guiding what are the gaps, what are the risks, what are the needs, not only during the emergency, but actually also before the emergency, and in those non-emergency times, what we call preparedness, so they can actually see the adjustments made, and they contribute also to adjustments in health service delivery or information response, and ultimately be better prepared again for the emergency. Next slide. Okay, in terms of top-down approaches in the health response, there's some recommendations that talk about providing options and avoiding imposing one-way solutions. So it's important that we consider that trust can only come into play when the individual or the community has the freedom to act and decide on the measures that affect them, and on the way services are delivered, or even on the strategies to confront an emergency. If there's like an imposition, it's very unlikely that we're gonna promote trust, right? We may actually get the behavior that we want for that specific moment, but it will very actually like fire back in our future relation with that community. So it's important to consider the possibilities of communities to take action on the instructions given. So actually consider the context and do not provide options that are totally out of hand, or like talk about services that are not available. Maybe we can talk about them, but actually also mention why they're not there and what are we doing to ensure that they're coming. That actually came into play in the COVID-19 response when vaccines were available in some contexts and not in others. Then it's also essential to promote a two-way trust by acknowledging actually that people will ultimately take the decisions that makes more sense for their realities, and try to open the dialogue from there, even if we're talking with positions that are very resistant to the outcomes that we, or like the actions that we're expecting communities to take. Then it's important that we consider conducting social listening and collecting feedback and acting on the findings. So we need to explain why we're collecting that data, and also making sure that we can act on that data. Because a lot of times, yes, we collect the data and then there's not actually the bandwidth or the capacity to respond to what communities are sharing with us. So, and that obviously creates a frustration and further mistrust in our intervention or in the presence or why we're there. So it's essential to assess before conducting the data, what can we do, and make very clear that with communities. And when we share the findings of the social listening data, it's essential to listen also to recommendations and solutions that come from the community itself on how we can address those issues. Next slide. Sorry, no, sorry, I missed one. Then it's essential to maintain long-lasting relations and collaborations. And with that, again, it's like identifying those actors that are at the local level, that are present in the community when humanitarian actors leave, that are present during the emergency, after and before the next one, and trying to build from there. So including local media, for example, in relevant coordination platforms such as RCC, coordination meetings or media working groups to ensure two-way dialogues with them. Also allowing feedback and criticism also from media practitioners. This actually allows further accountability to affected populations and further mistrust and further trust, because we're maintaining a transparent approach. And finally, would be good also to ensure that when we leave, there's a transfer of capacity and tools to ensure that local media or civil society organizations are equipped to fill the gaps and continue with that ongoing relation with communities, potentially listening to conducting social listening, responding to questions when there's an emergency, preparing the community, even supporting health literacy, and also being able to escalate any kind of risks to other decision makers when needed. And finally, on this set of recommendations, we have those for questionable intentions that talk about being transparent about processes and intentions to maintain trust. So this is about discussing not only the what and when of public health measures, but also the why, the how, and the different decisions taken during the emergency, and advocating for and training public health authorities to maintain that transparent approach. And finally, just a final couple of recommendations. Next slide. On the third avenue, which is inequity as part of the information response. So in terms of access to relevant information, it's important to build preparedness of the information ecosystem for health emergencies. And just as public health actors focus on strengthening health system capacity, is essential to also try to strengthen the capacity of those information actors that can actually contribute to the information response when the emergency breaks out. And for this, it's important to formulate RCC strategies and plans that incorporate all actors within the information ecosystem, identify the main gaps that impact their optimal collaboration, and try to fill those, also as a way to build further bridges with local actors of the information ecosystem. Then it's important to provide contextualized, localized, and actionable information. And to do that, it's important to support communities to lead the production of information in formats that allow two-way communication. So it's not only about translating, it's actually about allowing those community actors and structures to lead the prioritization of the information and to lead how it's going to be shaped and how it's going to be disseminated. And also it's very important to train community leaders, for example, or CSOs to consider the needs and the barriers of specific groups within their communities. A lot of times, even within a community, there's always going to be like power dynamics, power relations, certain groups being left out. So it's important that we continue, even within communities, that we continue considering these inequities and try to make them aware of the different barriers and risks that these other groups within the community face. And finally, in terms of the dissemination of information, our recommendation is to pair any kind of information with the availability of services or clear actions on the next steps in the emergency, all along the different, obviously, stages of or evolution of the crisis. So if services are not available or there's unclarity about next steps, it's important not to remain silent, and always and continuously inform about adjustments. Obviously, there's always going to be moments or like issues that we cannot share publicly or that may have like some level of confidentiality that it's not possible to share, but this is about like maintaining the dialogue and making sure that communities feel that they're in the loop and they know what's going on, and share be as transparent as possible, just sharing what we know and what we don't know. So this is up to here for the recommendations, and now I'm gonna also pose a question to our implementing partners, also on recommendations. So what practical stages have you implemented to help mitigate or address the impacts of inequity-driven mistrust? I'm gonna start now with Salam, as we started before with Juliana. So over to you, Salam. What have you done to address some
I think
issues?
One of the keywords you have mentioned is dialogue. So I think there's in our communities, there's no real dialogue. Actually, everyone talks, and in such a information ecosystem we have, there is a huge inequity in the production of news and information. So creating dialogue is very, very important for us. And then one of the strategies actually to create dialogue is one of the steps we have made is how to restructure the organization itself, because there's a very huge, our news organizations, especially the newsrooms in my country, for example, they are not inclusive, they are actually not gender balanced, and actually they are marginalizing actually those who do not have access to information. So one of the major issues we have been through is how to restructure the organization. And among them is how to use media and information, verified information, to create dialogue among communities in the areas we cover. And this needs actually to a next step, which is how you build your teams. This is a very, very important issue for us because, as I told you, having a very inclusive, gender balanced, representative newsroom is very, very crucial to produce fact-based quality journalism in such cases, and also in this way encouraging a fruitful dialogue among communities and then in my experience, I've seen this actually, even if you have got a very, very neutral platform, and then if you have got all parties on the table to start a dialogue, but if you don't have verified, good quality journalism, all parties have been involved, they do not have enough information, they cannot have a fruitful dialogue. So one of the very, very important strategies is to how to restructure the organization, build the teams within the newsroom, and also producing fact-based, verified information to this. So and what I think you have also mentioned this, we have been through this, building this continuous contacts with your audience, with the locals, with the marginalized groups, actually builds a lot of trust between you and them. You should never leave them. And then being in constant contact with them will help you to work in a very good way in times of crisis, in times of pandemics. So these are some of the strategies actually we have used also to mitigate on that, and also partner at the local level and also international level to stay there, to provide support, and also to connect everyone and help them actually to receive, to consume verified quality journalism that helps them to create dialogue and go forward.
Thank you very much.
Thanks, Salam. That was actually very informative and very illustrative of some of the issues that we've been mentioning throughout the recommendation section. Now over to Juliana.
Ok.
Sí.
Le voy a darle la palabra a mi compañera que va a decir unos y después yo digo los otros.
Vale, perfecto.
Sí, entonces pues digamos que desde Sinergias hemos podido implementar varias estrategias para de alguna forma enfrentar esa desconfianza que se puede generar por las inequidades, especialmente pues en la región amazónica de Colombia. Inicialmente, lo principal es generar un diálogo y un trabajo constante con las comunidades, quienes se involucran en los procesos más bien como unos aliados, y de esta forma ellos pueden, digamos, co-crear estos procesos. em, de esta forma pueden también reconocer un poco sus necesidades y las herramientas propias con las que ellos cuentan para fortalecerse y dar, digamos, procesos de largo aliento. Em, También algo muy clave es poder generar proyectos o, digamos, algún proceso que esté conectado a las bases de las organizaciones con las que estamos trabajando, para así crear sostenibilidad en el tiempo, porque son procesos que se empiezan a gestar dentro de las comunidades. Y por otro lado, pues al estar gestados desde las comunidades, estas mismas son las que se benefician de lo que se esté realizando, ¿sí? No solamente es como la organización externa que llega a proponer los proyectos, sino desde adentro, qué herramientas, con qué contamos para el mismo beneficio de las comunidades. Y por otro lado, digamos que Sinergias es muy partidaria de fomentar el enfoque diferencial para el reconocimiento de los saberes propios. Y digamos que esto es clave para tener mejores resultados en la creación de procesos que busquen también un poco como generar más confianza con las comunidades, porque esto permite que ellos se sientan representados de alguna forma en la construcción de los procesos y también, digamos, como en los resultados que surgen de esos procesos. Entonces, no solamente es como estar en el proceso inicial de una reunión o una concertación, sino involucrar a estas comunidades en el resto de los pasos, hasta incluso en la evaluación de las actividades que estemos realizando en el territorio.
Ok. Y pues para continuar, también está, digamos, el trabajo de sinergia se caracteriza sobre todo por la articulación con todos estos sabedores o traditional healers, como se tradujo ahorita, que orientan a toda la información que construimos, todas las actividades que construimos. Ellos son quienes tienen en cuenta este enfoque diferencial, sobre todo desde su posición un poco más cercana a las tradiciones que lo que nosotros como externos podemos analizar. Em, De igual forma, todos los procesos buscan reforzar y fortalecer las capacidades locales de las comunidades. Esto un poco con lo que decía Valentina, de que los procesos queden en las comunidades y no dependan de un agente externo para su éxito y sobre todo para su continuidad en el tiempo. Es un poco lo que surgió también de este proceso que realizamos con Internews, en el que después de tener un grupo de personas dispuestas, de las comunidades dispuestas a analizar todos los temas de comunicación y de información, quedó allí un colectivo como iniciativa desde las mismas comunidades para las comunidades, un poco como en este tema de analizar la información y poder producir información local. Y finalmente, es muy importante el desarrollo de materiales educativos, comunicativos, que expliquen todo lo que se trabaja con las comunidades, pero que sea en su propio lengua, sobre todo, que reconozcan también, lo que les digo, su lengua propia, sus formas de contar, que además tenga elementos gráficos que también se asocien con su región y con sus intereses, es decir, hacerlos partícipes también de estos materiales que quedan y que se construyen en conjunto. Es muy valioso y es muy importante, y hemos visto que ha tenido mejor feedback de las comunidades este tipo de iniciativas.
Well, thank you very much to all of our participants, to Valentina, Salam, and Rocio, for all the information, and for all of you for attending. We hope this was insightful. If you have any comments or questions that you want to share with us, please do not hesitate to reach out. You will be getting a link to the video recording as well as the slides in the next few days. So thank you very much, everyone, and please keep an eye out for our upcoming webinar happening next month, which is going to be looking at information ecosystem preparedness. How do you prepare information ecosystems for future health emergencies? So thank you very much, everyone, for joining, and hope you have a good rest of your day.